101. Which of the following can help manage heat intolerance in MS patients? A. Avoiding physical activity. B. Wearing lightweight, loose clothing. C. Drinking caffeinated beverages. D. Increasing exposure to sunlight. Answer: B. Wearing lightweight, loose clothing. Rationale: wearing lightweight, loose clothing can help manage heat intolerance, a common symptom in MS, by preventing overheating. 102. Which of the following MS treatments can cause a serious side effect of progressive multifocal leukoencephalopathy, PML? A. Dimethyl fumarate. B. Natalizumab. C. Glatiramer acetate. D. Teriflunomide. Answer: B. Natalizumab. Rationale: natalizumab, an MS treatment, is associated with an increased risk of progressive multifocal leukoencephalopathy, PML, a rare and serious brain infection caused by the JC virus. 103. Which of the following is an important lifestyle recommendation for MS patients with fatigue? A. Avoid napping during the day. B. Exercise regularly to improve energy levels. C. Limit fluid intake to prevent frequent bathroom trips. D. Increase intake of caffeine to stay alert. Answer: B. Exercise regularly to improve energy levels. Rationale: regular, moderate exercise can help improve energy levels and reduce fatigue in MS patients. It's important to balance activity with rest. 104. Which of the following MS medications is associated with a risk of lymphopenia? A. Interferon beta. B. Fingolimod. C. Glatiramer acetate. D. Teriflunomide. Answer: B. Fingolimod. Rationale: fingolimod is associated with lymphopenia, which can increase the risk of infections. Regular blood counts should be monitored during treatment. 105. Which of the following is an early symptom of MS? A. Complete loss of vision. B. Numbness or tingling in the limbs. C. Severe headaches with vomiting. D. Sudden onset of seizures. Answer: B. Numbness or tingling in the limbs. Rationale: numbness or tingling in the limbs is often one of the first symptoms of MS due to demyelination of sensory pathways in the CNS. 106. Which type of MS is characterized by a gradual worsening of symptoms without remission? A. Secondary progressive MS. B. Primary progressive MS. C. Relapsing remitting MS. D. Progressive relapsing MS. Answer: B. Primary progressive MS. Rationale: primary progressive MS is characterized by gradual, continuous worsening of symptoms without periods of remission or relapse. 107. Which of the following is the most appropriate way to help a patient with MS manage their spasticity? A. Provide a high-protein diet. B. Recommend heat therapy to relax muscles. C. Encourage passive range of motion exercises. D. Avoid physical activity to prevent further strain. Answer: C. Encourage passive range of motion exercises. Rationale: passive range of motion exercises can help maintain muscle function and reduce the effects of spasticity in MS patients. 108. Which of the following complications is commonly seen in advanced stages of MS? A. Cognitive dysfunction. B. Migraine headaches. C. Skin cancer. D. Vision loss due to glaucoma. Answer: A. Cognitive dysfunction. Rationale: cognitive dysfunction, including memory problems and difficulty with concentration, becomes more common as MS progresses. 109. Which of the following MS medications is typically used as first-line therapy for relapsing forms of MS? A. Glatiramer acetate. B. Natalizumab. C. Interferon beta. D. Mitoxantrone. Answer: C. Interferon beta. Rationale: interferon beta is commonly used as a first-line treatment for relapsing forms of MS as it helps reduce the frequency and severity of relapses. 110. Which of the following strategies is most effective for preventing MS relapses? A. Strict bed rest. B. Early initiation of disease-modifying therapy. C. Frequent courses of corticosteroid therapy. D. Long periods of physical inactivity. Answer: B. Early initiation of disease-modifying therapy. Rationale: early initiation of disease-modifying therapy, DMT, is the most effective strategy to reduce the frequency and severity of relapses in MS. 111. Which of the following is most commonly associated with the onset of MS? A. Trauma or injury. B. Infection or virus exposure. C. Autoimmune disease. D. Pregnancy. Answer: B. Infection or virus exposure. Rationale: MS is thought to be triggered by viral infections or environmental factors that cause an autoimmune response leading to demyelination. 112. What is the primary mechanism behind the symptoms of MS? A. Nerve cell destruction due to viral infections. B. Immune system attacks on the myelin sheath. C. Hormonal imbalances affecting the CNS. D. Blockage of blood flow to the brain. Answer: B. Immune system attacks on the myelin sheath. Rationale: in MS, the immune system attacks the myelin sheath, leading to nerve damage and the neurological symptoms characteristic of the disease. 113. Which of the following MS medications is classified as a monoclonal antibody? A. Glatiramer acetate. B. Teriflunomide. C. Natalizumab. D. Dimethyl fumarate. Answer: C. Natalizumab. Rationale: natalizumab is a monoclonal antibody that works by blocking immune cell migration across the blood-brain barrier, reducing inflammation in MS. 114. Which of the following best describes the pathophysiology of MS? A. Loss of neurons in the central nervous system. B. Disruption of the blood-brain barrier and inflammation of the myelin. C. Accumulation of plaques in the brain. D. Reduced production of neurotransmitters in the brain. Answer: B. Disruption of the blood-brain barrier and inflammation of the myelin. Rationale: MS involves inflammation and demyelination in the CNS due to immune system activity, which disrupts the blood-brain barrier and damages the myelin. 115. Which of the following MS medications can cause liver toxicity? A. Teriflunomide. B. Fingolimod. C. Interferon beta. D. Dimethyl fumarate. Answer: A. Teriflunomide. Rationale: teriflunomide can cause liver toxicity and liver function tests should be monitored during its use. 116. A patient with MS is prescribed baclofen for spasticity. What is an important side effect to monitor for? A. Increased heart rate. B. Muscle weakness. C. Dizziness and drowsiness. D. Elevated blood glucose. Answer: C. Dizziness and drowsiness. Rationale: baclofen, a muscle relaxant, can cause dizziness and drowsiness as common side effects, and the patient should be monitored for these. 117. Which of the following nursing interventions is important for a patient with MS experiencing a relapse? A. Encouraging prolonged bed rest. B. Administering high-dose corticosteroids as prescribed. C. Limiting fluid intake to reduce urinary frequency. D. Encouraging physical activity to avoid muscle stiffness. Answer: B. Administering high-dose corticosteroids as prescribed. Rationale: high-dose corticosteroids are commonly used during an MS relapse to reduce inflammation and speed recovery from symptoms. 118. What is the primary benefit of physical therapy for a patient with MS? A. It can cure the disease. B. It reduces muscle spasticity and improves mobility. C. It increases the production of myelin. D. It prevents urinary incontinence. Answer: B. It reduces muscle spasticity and improves mobility. Rationale: physical therapy is helpful in reducing spasticity and improving mobility, thus helping MS patients maintain or improve function. 119. What is the role of occupational therapy in managing MS symptoms? A. To improve cognitive function. B. To teach adaptive strategies for daily activities. C. To provide drug therapy. D. To monitor blood pressure and heart rate. Answer: B. To teach adaptive strategies for daily activities. Rationale: occupational therapy helps MS patients learn adaptive techniques to manage daily tasks, enhancing independence and quality of life. 120. Which of the following MS-related symptoms can be most effectively managed by medications like amantadine? A. Cognitive decline. B. Visual disturbances. C. Fatigue. D. Bladder incontinence. Answer: C. Fatigue. Rationale: amantadine is often used to manage fatigue in MS patients, as it can help improve energy levels and reduce tiredness. 121. What is the typical age range for the onset of MS? A. 10 to 20 years. B. 20 to 40 years. C. 40 to 60 years. D. 60 to 80 years. Answer: B. 20 to 40 years. Rationale: MS most commonly presents between the ages of 20 and 40, although it can occur at any age. 122. A nurse is assessing a patient with MS who reports double vision. Which cranial nerve is most likely affected? A. Cranial nerve 2. B. Cranial nerve 6. C. Cranial nerve 3. D. Cranial nerve 4. Answer: B. Cranial nerve 6. Rationale: double vision, diplopia, is often due to dysfunction of the abducens nerve, cranial nerve 6, which controls lateral eye movement. 123. Which of the following is a common long-term complication of MS? A. Cerebral edema. B. Heart failure. C. Cognitive dysfunction. D. Peripheral neuropathy. Answer: C. Cognitive dysfunction. Rationale: cognitive dysfunction, including memory and concentration issues, is a common long-term complication of MS, especially in progressive stages. 124. Which of the following is an appropriate intervention for managing MS-related constipation? A. Administering diuretics. B. Encouraging high-fiber foods and fluid intake. C. Providing opioid analgesics for relief. D. Restricting fluid intake to reduce bowel movements. Answer: B. Encouraging high-fiber foods and fluid intake. Rationale: high-fiber foods and adequate hydration are key interventions for managing constipation, a common symptom in MS. 125. Which of the following is true regarding the relapsing-remitting form of MS? A. It progressively worsens without periods of remission. B. It is the most common form of MSC. It causes constant, severe neurological deficits. D. It is characterized by progressive worsening of symptoms. Answer: B. It is the most common form of MS. Rationale: relapsing-remitting MS is the most common form, marked by episodes of exacerbation, relapses, followed by periods of recovery or remission. 126. Which of the following symptoms is indicative of an MS exacerbation? A. Gradual onset of weakness in one limb. B. Sudden visual disturbances with no other symptoms. C. Numbness or tingling in multiple extremities. D. Loss of bladder control that resolves in 24 hours. Answer: C. Numbness or tingling in multiple extremities. Rationale: numbness or tingling in multiple extremities is a common sign of MS exacerbation, resulting from demyelination in the central nervous system. 127. Which of the following is an appropriate goal for a patient with MS who has difficulty with balance and coordination? A. Increase the patient's physical activity level. B. Encourage weight-bearing exercises to prevent muscle atrophy. C. Promote the use of assistive devices, such as walkers or canes. D. Encourage the patient to avoid all physical activity. Answer: C. Promote the use of assistive devices, such as walkers or canes. Rationale: assistive devices help improve balance and coordination, enhancing safety and mobility for MS patients. 128. Which of the following strategies is most beneficial for a patient with MS experiencing heat intolerance? A. Warm baths to relax muscles. B. Increasing room temperature for comfort. C. Using cooling garments or fans. D. Avoiding all physical activity. Answer: C. Using cooling garments or fans. Rationale: cooling garments or fans can help manage heat intolerance in MS patients, which can exacerbate symptoms. 129. What is the first-line treatment for acute MS exacerbations? A. Plasmapheresis. B. Oral corticosteroids. C. High-dose intravenous corticosteroids. D. disease-modifying therapy. Answer: C. High-dose intravenous corticosteroids. Rationale: high-dose intravenous corticosteroids are the first-line treatment for acute MS exacerbations to reduce inflammation and accelerate recovery. 130. Which of the following assessments should be prioritized in a patient with MS who is experiencing cognitive decline? A. Monitoring vital signs. B. Assessing the patient's ability to perform activities of daily living. C. Measuring bladder function. D. Monitoring for skin breakdown. Answer: B. Assessing the patient's ability to perform activities of daily living. Rationale: cognitive decline in MS can affect daily functioning, so assessing the patient's ability to perform ADLs is crucial to planning care. 131. Which of the following symptoms is typically seen in primary progressive MS? A. Sudden onset of sensory disturbances. B. Gradual, steady worsening of symptoms without remissions. C. Recurring periods of exacerbation and remission. D. Visual disturbances during relapses. Answer: B. Gradual, steady worsening of symptoms without remissions. Rationale: primary progressive MS is characterized by gradual progression of symptoms without distinct episodes of exacerbation and remission. 132. A patient with MS reports a pins and needles sensation in the arms. Which of the following terms is used to describe this symptom? A. Dysphagia. B. Paresthesia. C. Dysarthria. D. Apraxia. Answer: B. Paresthesia. Rationale: paresthesia refers to abnormal sensations such as tingling, pins and needles, or numbness, commonly experienced by MS patients. 133. A nurse is providing education on MS to a newly diagnosed patient. Which of the following statements by the patient indicates a need for further education? A. I need to rest during MS flare-ups. B. I can expect to have periods where symptoms get worse and then improve. C. Exercise will worsen my MS symptoms. D. I should avoid infections to prevent relapses. Answer: C. Exercise will worsen my MS symptoms. Rationale: exercise can improve strength, coordination, and fatigue in MS patients, but the patient should avoid overexertion. 134. Which of the following lifestyle changes is most beneficial for an MS patient with fatigue? A. Avoiding all physical activity to conserve energy. B. Maintaining a regular exercise schedule and balanced diet. C. Sleeping during the day and staying awake at night. D. Increasing caffeine intake to improve alertness. Answer: B. Maintaining a regular exercise schedule and balanced diet. Rationale: regular exercise, balanced nutrition, and proper sleep are essential for managing fatigue and improving overall well-being in MS. 135. A nurse is preparing to administer interferon beta, 1A for MS. Which of the following is an important instruction for the patient? A. You should take the medication on an empty stomach. B. You may experience flu-like symptoms after injection. C. This medication is taken orally on a daily basis. D. This medication can be stopped abruptly if you feel unwell. Answer: B. You may experience flu-like symptoms after injection. Rationale: interferon beta, 1A can cause flu-like symptoms, including fever, chills, and muscle aches, especially after the first few injections. 136. A patient with MS is experiencing urinary incontinence. Which intervention should be included in the care plan? A. Restrict fluid intake to reduce frequency. B. Perform pelvic floor exercises to strengthen the muscles. C. Encourage the use of diuretics to prevent urgency. D. Increase caffeine intake to reduce bladder irritation. Answer: B. Perform pelvic floor exercises to strengthen the muscles. Rationale: pelvic floor exercises can help manage urinary incontinence by strengthening the muscles that control bladder function. 137. Which of the following is the most common initial symptom of MS? A. Ataxia. B. Visual disturbances. C. Dysphagia. D. Hearing loss. Answer: B. Visual disturbances. Rationale: Visual disturbances, such as optic neuritis, are often the first symptom of MS, resulting from inflammation of the optic nerve. 138. What is the primary function of disease-modifying therapies, DMTs, in MS management? A. To cure the disease. B. To alleviate pain and inflammation. C. To slow the progression and reduce relapses. D. To enhance cognitive function. Answer: C. To slow the progression and reduce relapses. Rationale: disease-modifying therapies, DMTs, are aimed at slowing the progression of MS and reducing the frequency and severity of relapses. 139. Which of the following is a common trigger for MS relapses? A. High-fat diet. B. Increased physical activity. C. Infection or illness. D. Alcohol consumption. Answer: C. Infection or illness. Rationale: infections, including respiratory or urinary tract infections, can trigger MS relapses or worsen symptoms. 140. A patient with MS is prescribed the drug fingolimod. Which of the following assessments is most important to monitor during treatment? A. Blood pressure. B. Liver function tests. C. Visual acuity. D. Heart rate and rhythm. Answer: D. Heart rate and rhythm. Rationale: fingolimod can cause bradycardia and other cardiac issues, so heart rate and rhythm should be monitored, especially during the first dose. 141. A nurse is educating a patient with MS on the importance of preventing skin breakdown. Which of the following strategies is most effective? A. Encouraging frequent repositioning and use of pressure-relieving devices. B. Encouraging long periods of sitting in a wheelchair. C. Avoiding all physical activity to prevent skin irritation. D. Applying ointments to the skin daily. Answer: A. Encouraging frequent repositioning and use of pressure-relieving devices. Rationale: frequent repositioning and the use of pressure-relieving devices can reduce the risk of pressure ulcers and skin breakdown. 142. Which of the following symptoms is most commonly associated with secondary progressive MS? A. Sudden, severe flare-ups. B. Gradual worsening of symptoms with or without relapses. C. Complete resolution of symptoms during remissions. D. Severe cognitive impairment and ataxia. Answer: B. Gradual worsening of symptoms with or without relapses. Rationale: secondary progressive MS involves gradual worsening of symptoms, with or without distinct relapses. 143. A patient with MS is experiencing blurred vision. Which condition is most likely causing the symptom? A. Optic neuritis. B. Brainstem lesion. C. Spinal cord lesion. D. Cerebellar ataxia. Answer: A. Optic neuritis. Rationale: optic neuritis is an inflammation of the optic nerve and is a common cause of visual disturbances in MS. 144. Which of the following is an appropriate dietary recommendation for a patient with MS? A. A low-protein, high-carbohydrate diet. B. A low-salt, high-fat diet. C. A high-protein, high-fiber diet. D. A low-protein, low-carbohydrate diet. Answer: C. A high-protein, high-fiber diet. Rationale: a high-protein, high-fiber diet is beneficial for MS patients, helping to maintain muscle strength, energy levels, and digestive health. 145. Which of the following is a common psychological symptom in MS patients? A. Hyperactivity. B. Depression. C. Mania. D. Hallucinations. Answer: B. Depression. Rationale: depression is common in MS patients due to the disease's neurological impact and potential psychosocial stressors. 146. A patient with MS is experiencing difficulty with walking and balance. Which type of therapy would most benefit this patient? A. Respiratory therapy. B. Occupational therapy. C. Speech therapy. D. Physical therapy. Answer: D. Physical therapy. Rationale: physical therapy is essential for improving mobility, balance, and coordination in MS patients who experience walking difficulties. 147. A nurse is educating a patient with MS about the importance of preventing infection. Which of the following practices should be emphasized? A. frequent hand washing and avoiding crowded places. B. Resting for long periods to avoid exhaustion. C. Avoiding vaccinations to prevent adverse reactions. D. Restricting fluid intake to prevent bladder infections. Answer: A. Frequent hand washing and avoiding crowded places. Rationale: infection prevention is critical in MS to avoid triggering relapses, so hand hygiene and avoiding exposure to illness are important. 148. Which of the following is the primary goal of MS treatment? A. To cure the disease. B. To improve the patient's quality of life. C. To prevent infections. D. To delay the need for a wheelchair. Answer: B. To improve the patient's quality of life. Rationale: the primary goal of MS treatment is to manage symptoms, reduce relapses, and improve the patient's quality of life. 149. Which of the following activities can be safely recommended to a patient with MS? A. Intense physical exercise in a hot environment. B. Swimming in a cool pool. C. Extended periods of rest in a heated room. D. Exposure to cold weather for long periods. Answer: B. Swimming in a cool pool. Rationale: swimming in a cool pool can help MS patients exercise without overheating, which can worsen symptoms. 150. A nurse is discussing coping strategies with a patient newly diagnosed with MS. Which of the following statements indicates effective coping? A. I plan to ignore my symptoms and push through them. B. I will avoid talking about my diagnosis with others. C. I will learn more about MS and discuss it with my family. D. I will stop taking my medications if I feel better. Answer: C. I will learn more about MS and discuss it with my family. Rationale: effective coping includes being informed about the disease and involving family in the process for emotional support and better management.